In Domain 3, we're going to cover topics of informatics, analytics, and data use. And as I'm sure you know, this covers a very broad range of details. And I know you've learned it all, so let's review. Technology with regard to software that is used in the healthcare industry, you should be very familiar with this. Electronic health records, patient portals, patient management systems, encoders, computer assisted coding, speech voice recognition software. You should just essentially know what each one is and know what its purpose is in our facility. Hardware. Again, desktop computers, laptop computers, servers, smartphones, tablets. You want to make sure that you understand their place and purpose and what they are. The questions on the test will more likely be discussing them, so you have to have a clear understanding of how they are used in healthcare so that you can understand the whole entire question and what they're asking about. Okay, now when we talk about informatics and analytics and data, we have to remember that as health information management and health informatics professionals, we are charged with not only collecting the data, storing the data, analyzing the data, and then once we do that, we need to present the data very often to the executive board or the board of governors or whoever it might be. So you want to make sure that you review and review and review the different types of charts and how these are used. Plan, Do, Check, Act, PDCA. Plan, Do, Study, Act, PDSA. The flow process chart, affinity grouping, the nominal group technique. We want to make certain that we are that you are understanding how and when each one of these different types will be used, because part of this is not only do you know what a pie chart is, but do you know when the most appropriate time to use a pie chart is and when a line graph might be more efficient or effective for communicating. That's what this is all about. The various types of charts, and again, when is the best time? What are we trying to communicate? The fishbone diagram is going to illustrate cause and effect or the root cause of something. The Pareto chart is going to illustrate the 80-20 business rule and force field analysis. All of these things. When is this the best way to graph, to provide an illustration of the data? Scatter diagrams are used to plot 2 points of 2 variables that are suspected to be related, and this plotting may prove that to be true or not. You need to know how to interpret a scatter diagram, because I personally can remember a question on my RHIA that said, look at this graph. Does it prove this? Does it prove that? Or what does it prove? Okay. Bar charts and histograms, it took me a long time to truly understand the difference, and that's why I gave you these pictures side by side. There are 2 essential differences, okay? The first is visually, the histogram does not have gaps between the bars, and the bar chart does have gaps between the bars. All right, I can hear you. You're saying, so what? All right, I don't know. But the more important detail is bar graphs or bar charts are used to track or illustrate categories of things, whereas histograms are used to identify or illustrate specific numbers or ranges of numbers. A run chart. You may initially look at this and say, well, that's a line graph. And it is a line graph, except you'll notice this line, dark black horizontal line that's going about the middle, and it's marked on the right side as 0. And a run chart is going to give something, details about something over a period of time, and you're going to plot, is it over this black line or under this black line? Now, this black line, for example, this might be number of injuries on the job, staff injuries on the job, okay? Or it might be anything else that you need to be comparing the data to a specific threshold. Okay, so essentially we're looking at above and below a certain point. Whereas a line graph or line chart only plots the trending of the data. It does not give a threshold or a point of above or below. Okay, a process control chart is similar to a run graph and a line chart. However, it has, instead of having that center threshold to measure above and below, a process control chart is going to measure within a range. As long as the data points that you can see by this line are within the upper and lower ranges, then that's saying that's okay. All right. All right. Formulas for analysis. Make sure you look at that. I provided you with a 1-page of the key formulas, the most frequently used formulas for health information management. You have more formulas in your textbook, the Oates Waters book. If you cannot find the formula sheet in the course room, email me and I'm happy to share it with you, okay? But you need to become familiar with the formulas. You need to understand what detail is being expressed by the results of the formula. What are we looking to know? Okay, so basics: mean, median, mode. Mean is the average. Median is the middle. So the way I always remember median is I think of the interstate, and the median is that grass strip in the center of the interstate. And there are always exactly the same number of lanes on one side of the median as the other side of the median. So that tells you there's always the same number of numbers above and below the median number. Whereas the mean, the average, we take all the numbers, we add them together and divide by how many numbers we added together. Okay, that won't necessarily be in the middle. And then mode is the number or piece of data that shows up most frequently. Census formulas. Average daily census is essentially the average number of patients that there are in the facility. And we use the IPSD. You will see this abbreviation. It stands for Inpatient Service Days. You can see it on the bottom of the slide. Get comfortable with that, okay? And percent of occupancy is the inpatient service days divided by the number of beds, whereas the census is divided by the number of days. Okay, average length of stay, very important. Average length of stay is determined by the discharge days divided by the total number of discharges. Also, in the bed turnover formulas that tell us a great deal, be careful, look carefully. You'll notice there are 2 different bed turnover formulas, the direct and the indirect, and they are different. The death rate is important because the number of people, or a high percentage, not number, but percentage of individuals that die in any healthcare facility can be a marker with regard to the type of care being provided in that facility. Not necessarily. You have to look at other factors of the population, but still it's important. Total number of deaths over the total number of discharges will tell how many people, the percentage, again, the percentage of patients that passed away instead of being discharged home or to another facility. And there is a gross and a net, or also known as the institutional death rate. And you'll notice that this gives the institution or the facility a 48-hour window. And this has to do not with liability so much, but yes, liability, and not as a legal term, but in what did we do? The thinking here is if the patient dies within 2 days of being admitted, they must have been probably super really sick, and therefore it may not, probably not the fault of the facility. Okay. All right. Post-operative death rate is important, and this also has a time limitation. This has to do within 10 days. Again, the feeling is if the patient dies within 10 days after having a procedure, that the procedure could be the cause of death. However, after 10 days, the probability of the procedure causing the death of the patient is less likely. So when looking at post-op death rate, there is that time restriction. Fetal death rate only looks at the death of fetuses, not babies, fetuses at the intermediate and late term. So this is second and third trimester. Early fetal deaths in the first trimester are considered miscarriages or spontaneous abortions, and not typically with regard to care. Autopsies. This is important for the medical examiner within the hospital to substantiate their job. I mean, essentially is how many autopsies did the medical examiner in the hospital do on inpatient deaths? And then the net autopsy rate is the total number of inpatient autopsies divided by the total number of inpatient deaths minus unautopsied coroner cases, which means instead of the hospital doing the autopsy, it went to the city morgue to have the autopsy done there. And then there's the adjusted or hospital autopsy rate, which is the total number of hospital autopsies divided by the total number of deaths. So you might say, well, what's the difference between a hospital and an inpatient? And the difference is hospital will include patients who are under the hospital roof for outpatient procedures who may pass. Decision support. Now, this has to do with the other part of our job. And we've talked about we are responsible for determining or participating in the determination of what data needs to be collected and what data is collected. And then once we collect it, we are responsible for keeping it safe and storing it safely so that it is secure but available when someone needs it. Okay, so get familiar with these terms and what they are: data warehousing, data mining, transactional systems that house data such as electronic data processing and storage, database management, and GUIs, which stands for graphical user interface. Decision support continued. Also, get familiar with what a database DSS, decision support system, data-based, model-based, knowledge-based, graphics-based, DSS, decision support system. Get familiar with what SQL stands for. What does it stand for? Oh, it stands for Structured Query Language. And this is the basis of relational databases. And what that means is when you type into a database and you say, tell me how many patients between the ages of 50 and 60 were admitted last week, that's your query. And that tells the database what you want. And it uses SQL as a way of sifting through all the data that's in the database and coming up with the answer to your query. HL7 stands for Health Level 7. And this is the standard and frameworks for electronic health information to be exchanged. This is part and parcel of interoperability. Remember, if two computers can share data, it doesn't matter that they can share data if the other computer doesn't understand what that data is saying or what it means. This is the transactional standard. And then you'll see when we get to SNOMED, which is the language standard. CDA, Clinical Data Architecture. This is the standard for the structure and semantics of clinical documentation. Semantics means the meaning, specific meaning of words, how to interpret those words, those characters, those pieces of data. Measurement data. So what happens when we're comparing blood pressure and heartbeats and diagnoses and all of this stuff? You need to look and become familiar with these terms regarding measurement data. Nominal level, ordinal level, interval level, and ratio level. All of these describe different different types of data that are used in our measurements. Variables, understand the different type of variables. A discrete variable means it falls into very specific categories, like male or female, okay? Continuous variables have no gaps in the data. So if you're looking at weight, it would be 120 pounds, 121 pounds, 122 pounds. There's no break in the measurement category, okay? So let me give you an example. If you were to use a discrete variable with regard to patient weight, you could not use the number of pounds the patient weighs, but you could use underweight, normal, obese. That would be categories, and that would be a discrete variable. If you used a continuous variable, you would have to use the specific weight of the patient, the number of pounds. Statistics. Oh, thanks to computers, we love statistics because they give us truth. They give us facts, not perception. So make sure that you understand these terms with regard to statistics. What is a ratio, a proportion, rates, census data, bed occupancy rates, length of stay data? We talked about these formulas, remember? But make sure you are comfortable with what they mean and why we do this, because that's important. Okay, the last part of this that we're going to discuss has to do with credible and accurate research sources. And you should be using this every day, okay? Googling something and taking the first result is not a good idea, Okay, you must determine the credibility and accuracy of the source of the information. And SCOPA is a 5-letter or 5-step way to determine the credibility and accuracy of information provided to you on a website. Remember, anybody can create a website and put up whatever words and numbers they want. They can make it up. There is no law, there is no control forcing accuracy on website data. And also remember that people can skew, they can use their perception, they can use their opinion, and they can use their opinion and cite it like it was fact, like, I know for a fact. But okay, but that's really your opinion. It's not a fact. So, as professionals, we need to only look at the facts. And this is one of the ways that you need to do that is make certain that any resource you use is credible and is going to provide you with accurate facts. If you have any questions, please post to the RHIA exam prep discussion forum, and we'll be sure to help you out.